Welcome to this walkthrough of Beacon IO combinations. Hopefully you've had a chance to see our introductory video on what the product offers. This 5-minute functional demo will show you how it works. If you like what you see or have further questions, do just drop us an email and we can set up a full demo for you and your team. This is a comprehensive, accurate and real-time database of all of the clinical stage immuno-oncology combinations. With trials being initiated at a rate of 1 every 1.4 days, it's challenging to stay on top of all of the data, and with everything being combined with everything else, we wanted to create a simple and easy-to-use interface to give scientists access to specific curated trial data. The first thing we need to do is we need to filter the database down, and we can do this by looking at a particular disease area of interest, something as broad as solid tumors, or alternatively, something much more specific like urothelial cell carcinoma. We might also have a specific target of interest, for example, what combinations are targeting PD-1, or again, something a little bit more specific, for example, how are kinase inhibitors being used in different IO combinations. Today, though, we'll look at Nivolumab. This is an interesting checkpoint modulator for us to review because it's in a relatively small number of studies and it's also got a wide range of maturity associated with the results of that study. You'll see here now on the advanced search results that Nivolumab is included in some checkpoint doublets, checkpoint triplets, as well as combinations including chemotherapy, targeted therapy, and immunomodulators. If the results here were too general or too specific, we would have an opportunity to refine our results further and go over our initial 4 search parameters, as well as potentially adding in a keyword, sponsor, phase of development, specify our trial status, and even whether or not the trial has results or not. On a full demo, we'd have a lot more opportunity to go into detail here, but for now, I'll show you the results that fulfill this search criteria. So looking at this review of all of the trials that meet our search criteria now, we have the first opportunity to look comparatively at how the different studies are working. Overall, at this display, we'll see the critical information around the sponsor, intervention, disease indication and trial status, as well as any headline ORR or response rate data for a particular study. And certainly now I can take you into detail into one of those and we can have a look at some more of the specifics. This is a safety study of Nivolumab alone and in combination with ipilimumab or Nivolumab. And in the top section here you can see that we're detailing the specific agents that are involved, who's running the trial, what disease indications are being targeted, and also the key trial status information. For example, the study is recruiting, and also when the trial started and when it plans to end. Down in the middle of the page, we can see further details. For example, looking at the arms tab, we'll see the different cohorts detailed here, as well as what treatment regimes are being applied to them. We could have a look at the patients involved in this study, and there's much more further context around not just the number of patients that are being evaluated, but also what their pre-treatment status is, other key demographic information, for example, age, gender, and also specific details on the number and type of prior treatments that they've received before going on to this study. Now, more interestingly, we can look at toxicity results for this study. You'll see here we're detailing the adverse events tabularly, both at any grade and also at high grade, and down at the bottom, highlighting any specific results that are worthy of further review. For example, reasons for treatment discontinuation. Finally now, looking at the efficacy results that have been reported for this study, we have specific findings, for example, around the ORR, but also numbers of CRs and PRs, and also we're tabularly representing the sum total of the trial arms that have been reported and the individual cohorts that exist within that. Scrolling down to the bottom of the page now, we'll see in the commentary section that the context of this study is that the headline results reported so far are all within the monotherapy arm, and we eagerly await the results of the combination arm to be reported once trial recruitment has been completed. On the left-hand side of the page now, you'll see the key links and source material that we've used, with everything as simple as the clinical trial listing, through to something like an ASCO poster or presentation, in this case one that details the phase 1 plan, to something as specific as a New England Journal of Medicine paper that highlights the key toxicity and efficacy results that have been reported. All of these have been specifically curated to be relevant to only this trial, so you've only got the most relevant information at your fingertips. We hope you've enjoyed today's walkthrough, and certainly we'd welcome any further questions, comments, or requests for more information. You can just get in touch with us by emailing the address here or giving us a call, and certainly someone at the research at Hanson Wade team will be able to get in touch.